This month we have been asked to focus on the National Informatics Strategy and how this might impact the delivery of services locally. Despite some pockets of success, the National Programme for IT that many of us have worked on over the last 10 years has failed to live up to the expectations of IT leaders, clinicians and patients. Within the Bristol community we have benefited from the delivery of N3, GP-SOC, PACS and RIO for community and mental health, but the slow delivery of acute EPR has dogged the progress. The national strategy going forward has to be very different, and we believe it needs to contain three key elements. The first of these is interoperability. For years now we have been improving the collection of clinical information into electronic records, but by and large these still exist in silos, be that in GP systems, in community settings, in acute or in social care. Information exchange has tended to be point to point and very often not up to date enough to be reliable. Our local Connecting Care programme aims to join these clinical systems through a single portal, allowing clinicians to access the information as they require it. The second area of focus needs to be innovation. The NHS is often accused of being a bit behind the curve when it comes to the adoption of cutting-edge technologies. This is often for very good reasons, as we sensibly seek to use scarce resources on proven technology. Going forward, the need to operate in a more competitive environment, reduce costs and improve productivity will see these as a must-do. Avon IM&T consortium have begun a flash-to-bang programme aimed at massively increasing the speed at which we adopt new technologies. Early examples include the deployment of wireless technologies and the use of iPads for reviewing commissioning information. The third area, and probably the most important, is information. The draft information strategy and information revolution was consulted on over the winter and may well change by the time it is finally published later this year. But no one expects the priority given to information for patients to change. Revolution stated, people will have the information they need to stay healthy, to take decisions about and exercise more control over their care, and to make the right choices for themselves and their family. At Avon IM&T Consortium we have a solid track record of delivering information solutions, including our Avon Business Intelligence Data Warehouse and Reporting solution and our Health GIS product. Our challenge going forward is to make these services more patient-facing, so patients can access their health record online. Lastly, I would like to make a comment on the national strategy. It is clearly helpful to have a national framework to help us align delivery, marshal suppliers and deliver major cross-cutting infrastructure. However, the delay in the publication of a national strategy should not be seen as a reason to delay local delivery. Within our health community, we are getting on with it, delivering new technology to support healthcare. I suggest you do the same.